Okay, this is Dr. Bishop again. I'm going to talk about reliability and validity in diagnosis as a follow-up to my lecture on Diagnostic and Statistical Manual. Diagnostic systems are most useful when they're both reliable and valid. So reliability refers to measures that are consistent. Simple example is a scale you use to weigh yourself. You step on the scale, it records 100, 150, whatever the weight is. Step off the scale, step on the scale, you expect it to be very close or the same. If you get, one time it weighs 150, and the next time it weighs 140, and the next time it weighs 160, then you get inconsistent measurements. Now, in the area of the DSM, you're referring to when you're referring to reliability, you're referring to the degree to which different psychiatrists interviewing the same patient will arrive at the same diagnosis. Now, obviously, if one arrives at the diagnosis of personality disorder, another at the diagnosis of schizophrenia, and a third with some other diagnosis, you're not going to be very impressed with the outcome. If you take a medical example, for example, if you take your child to the doctor and one says it's a viral infection and one says it's a bacterial infection, and the third doctor says something different, it's obviously very confusing. You don't trust the outcome and the findings. So you really want consistency of diagnosis. Mental health experts should agree about diagnosis. It turns out that the earlier versions of the DSM, DSM 1, 2, and 3 in particular, had especially poor reliability. People recognized this problem, and so they evaluated the nature of the problem, and it became clear that the problem existed primarily because the criteria were vague and unclear. So they went back to the drawing board and got more objective and more specific and more detailed criteria. Then they tested it again by, presenting clinicians with the same taped interview to see if they'd make the same diagnosis. It did, in fact, improve the diagnoses, the reliability of diagnosis, but it's still far from perfect. And as I suggested in the last interview, in the last lecture, there's a fair amount of subjectivity in doing diagnosis, and you still get different outcomes by different clinicians, which doesn't, again, give you great confidence in the process. How is reliability measured? From a scientific, technical point of view, it's measured by correlation, and it's expressed as a correlation coefficient. In general, low correlations equal poor reliability. As a very, very brief and quick review, you may remember from intro psych that correlation coefficients vary from 0 to 1, plus or minus. The higher the absolute degree of the number, closer to 1, the higher the correlation. And it's especially useful to look at scattergrams and so forth. You may want to review that. But in any event, you would expect a high correlation would give you good reliability. Next, the issue of validity in diagnosis. If a diagnosis has a high degree of accuracy, it characterized what is supposed to be classifying, it would be valid. Validity refers to the meaning of the measurement or the meaning of the diagnosis. You can label, say, somebody something, but if it doesn't correlate with something useful or meaningful, predict something, or reflect on, say, a common etiology, then the label doesn't really mean anything. It's just a name. So the key question is, what does the people that have a common label, what does having that label correlate with? And in particular, do similar treatments, for example, in bipolar disorder. If you label a bunch of people as meeting the criteria for bipolar disorder, and then you give them lithium, and almost universally they improve. Whereas people with different diagnoses, you give them that same drug and it doesn't have any impact or just a bunch of side effects, then it gives you some confidence that your label has some meaning. So again, it has to do with the meaning of the diagnosis or label. One of the interesting things is that you can have these reliability and validity are independent concepts, and so you can have reliability without validity. In a class situation, I often give the example of suppose you're measuring head size as a measure of IQ. Well, most people would say, well, so you can ask the question, is that reliable? And most people get fooled by that. They say, well, geez, no, that's not reliable. And what they're thinking is it doesn't measure IQ. But that actually has more to do with the meaning of the label rather than the measurement process. So, for example, you get a tape measure and you measure the circumference of a person's head once, twice, 15 times, you're going to get the same outcome. It's going to, for my head size, I think, is about 6 7/8 inches. So you would have technically reliability. Would it measure IQ? It wouldn't correlate with anything that we usually think of as IQ, so it would not have validity. Again, validity has to do with the meaning of your diagnosis or measurement. And so good examples of validity usually are judged, again, by people with the same label, same diagnosis, share anything in their background and that might relate to the causation of their disorder. An example of that would be many people who have a diagnosis of dissociative identity disorder, multiple personality, it turns out have a very strong history of some type of abuse, either sexual or physical or some kind of neglect, some significant childhood abuse. Whereas if you take people that don't have that diagnosis, typically the base rate is much lower, say maybe 15–20%, whereas with multiple personality it may be as high as 80–90%. So the correlation there between a history of abuse and your label, gives some meaning to the label. Also, again, if you could say people with a same label will behave similarly or respond to the same treatment in the future, it gives you some confidence that your label or diagnosis is meaningful. So, does classification correlate with treatment effectiveness? Do those with the same classification have similar etiology? And another interesting, does the IQ test correlate with another IQ test, the Stanford Binet with the waist, or does it correlate with, say, success in doing difficult math problems, or problem solving, or success in school? So those are examples that would get at validity. I often give in class this TOTI, EMUL on the separate line, Emule Esto IQ test. I said, this is a measure of your IQ, tell me what this says. So if you want, just arrange those on 3 separate lines, Todi, Emule, Esto. Take some time, take a few seconds, tell me what that says. Is it a measure of your IQ? People usually don't get it right away. I say, well, I thought we had a pretty bright class, but I don't know now. Well, what does it say? Well, if you separate it right here, 2 tie mules 2. I actually have drawn a picture up on the board, and I put the Todi Emule Esto on the sign. And I ask them again about what it says. So when I get done, people that didn't get it, of course, are not feeling too smart. So I says, well, this is a measure of IQ. Well, as it turns out, that does not really correlate with some of the typical measures of problem-solving ability or success in school or things that you think of as IQ tests or, scores on traditional IQ tests like the Waithe or the Stanford-Binet. So it doesn't really have validity in the technical sense. So the main point I usually make with that is when you get a diagnosis or a test of any kind, the label itself does not give meaning to the test. So I think I'll stop here and move on to another topic.